What is a bunion? Right, so a bunion essentially is this. So we've got the long bone of the foot, the metatarsal. There's 5 metatarsals. The first metatarsal here that's drifting inwards, and the big toe itself is drifting out. Okay, so it's clocking out, and that's into a valgus position. So some people call it a hallux valgus, but it's colloquially known as a bunion. Also, what happens is you notice here in the second toe, if I twist that around, it starts fighting. These two are siblings, and they start fighting with each other, and so the second toe can start cocking up, as can the third as well. A lot of blame has been put in fashionable high-heeled pointy shoes, and this is not true. Bunions are inherited. So there's someone in the family that you can always point to. It might skip a generation. It may come from dad, not mum, or mum, not dad, but they certainly do come in the family. So don't blame yourself for footwear. The aim of bunion surgery, certainly keyhole bunion surgery, is to get you back into comfortable footwear. Yeah, so do bunions get worse over time? It's a great question. Lots of people ask this, and the answer is very difficult to tell. But essentially, what a bunion starts off with is the big painful bump on the side, and also a little bit on the top, which can be a little bit of an arthritic change. But as time goes on and the big toe pushes across, the second toe can get involved and the third toe can get involved. So the answer is yes, by definition, they can get a lot worse over time. What treatment options are available for bunions? So essentially, we look at this as conservative, so no operations, versus operative, so operations. There is no real conservative management to help with bunions. You can adjust your footwear. This is a really sensible way of dealing with things. So stretchy training shoes are really good, but really there's no such thing as a conservative cure for bunions. It's operation essentially. So the bones have to be broken, shift and locked with special implants or screws. How do I prepare for bunion surgery? Another great question. Essentially, you just have to choose a date. Firstly, you've got to have the right sort of presentation. So do you have pain? Do you have a bump? Is it affecting the second toe? It's really important to have the right sort of picture and also the right diagnosis. Bunions can be confused for arthritic changes. So you can have what's called a hallux valgus or a hallux rigidus. All of these can be dealt with through keyhole surgery, keyhole bunion surgery, and keyhole arthritic surgery. Are you put to sleep for bunion surgery? Yes, all my patients are put to sleep for bunion surgery. I believe in a general anaesthetic, so it relaxes the patient, makes them far more comfortable, and it's a controlled environment to perform the operation. I'm incredibly fortunate because all the anaesthetists that I work with are intensive care consultants. On top of the general anaesthetic, I do a local anaesthetic block. So I numb up some of the nerves of the foot before I start the operation, such that it's working when you wake up as well. So you get the most effect of that pain numbing experience. What are the benefits of keyhole bunion surgery? Okay, so these are smaller cuts utilised to break and shift bone. So it's quicker recovery, rapid on your feet, and you start stretching exercises at 2 weeks. You get back into shoes at 2 weeks, which is really important.